backwards. Okay, so you've got this little tiny tube where there's a stone inside of it, blocking the flow of urine and simultaneously being squeezed on. And so imagine we've all had a rock in our shoe and we're walking and it's driving us crazy. We have to take our shoe off and shake the stone out of there. So you constantly have this muscular squeeze against a rock, which can oftentimes be very sharp and have little horns and spines on them. And as well, you're blocking the flow of kidney. So you have this balloon effect within the kidney. And so both can be simultaneously very painful. They can affect you up here in the back as well as down into the front on either side, whichever your stone is on. And they do very often compare to childbirth. I've had many female patients that have told me it's worse than childbirth. I've had female patients that say it's number two, but certainly the patients are very symptomatic, very bothered and wanting something done immediately, which makes my job a little difficult because they'll watch their stone and not worry about it for months or years. But the moment it gets in that tube, they're calling, wanting something done yesterday. So it's definitely a problem.
I want to point out that I want everybody to wait till the end to talk about how we prevent kidney stones, because now, Joel, that you've explained this, I think everybody's next question is, how the hell do I prevent this from happening? There's still quite a few things to talk about kidney stones, and I want everybody to kind of wait till the end of the video, wait till close to the end of the video, and we're going to talk about prevention. But let's talk about, how do you get kidney stones? So what is it that we do as human beings on a day-to-day basis that eventually cause us to get these kidney stones?
So that exact question they write books about. In fact, I've written some book chapters and papers about myself. So it's certainly a very vast topic and not a straightforward answer. If there was a simple fix or a simple pill, I certainly wouldn't have a job. So to simplify the process, I think we've all been through like 7th grade chemistry, right? And think about table salt. I'm going to give you 2 little scenarios that can help you understand how stones are made and how you get stones. But one is, think about 7th grade chemistry and think about salt, table salt. You have a sodium, which is a liquid, and a chloride, which is a liquid. Well, you put those suckers together and it forms a little rock, table salt. So the same process occurs with different minerals within the urine drainage channels, where if you have a lot of some substance and a lot of another substance and they stick together, they'll form a little rock. In addition, there's several stones that are pH related, meaning the pH balance of your urine is off. And the vast majority of stones, I would say, an acidic environment, a lower pH and acidic environment, perpetuate stone formation, meaning, let's just use that salt example, that sodium and that chloride that want to come together and form a crystal. If you put them in an acidic environment, they get more attracted to each other. But there's another subset of stones which are more directly pH related. And the way I describe that to folks is, imagine water. Okay. In a very hot day, it turns into gas, it's a steam. In a very cold day, it turns into an ice cube. It's still water, right? But in different temperatures, it changes if it's a liquid, gas, or solid. So there's similar substances within the urine that at very acidic environments will crystallize without even attaching to another molecule, but just by itself crystallize and become a solid. There's other substances that come together in a very basic environment. So sometimes it's pH related. Other times it's just that you have a lot of the molecules and the substances within the urine that are wanting to come together and make stones.
So I don't mean to put you on the spot. And I mean, that was a very thorough explanation. It was very scientific. But to the layman, what are the activities? Like, what is it that I do? Like, is it something that I eat or don't eat or drink too much of? Like, for example, if I drink a lot of alcohol, is that causing it? Or if I don't drink enough water, what are the things that we as people do to to make the probability of getting a kidney stone higher?
Gotcha. So I would say the 2 big ones are dietary, because things are being filtered out of your blood and pushed into your urine to get it out of the blood. So if you have too much, say, calcium or sodium within your body. Sodium's a big one, and once we start talking about prevention, I'll talk again about sodium. But sodium's a big one that I see a lot, where your body's very sensitive to sodium. Sodium is responsible for your blood pressure going up and going down, right? Higher sodium brings more fluid into your vasculature, into your veins, and makes your blood pressure go up. Well, your body doesn't like high blood pressure.
Sodium is salt, right?
Salt, correct.
So high salt intake.
Correct. High salt intake. Your body's very sensitive to it because it wants to regulate the blood pressure. So your body immediately wants to push the salt out of the blood into the kidneys and let you pee it out. Okay. Well, there's a buddy system in the kidneys. The salt can't just get out of the kidney without its buddy. So it grabs its buddy, which is a calcium. So every time a salt is being pushed out of your kidneys, it's pulling a calcium with it. Well, the majority of stones are calcium-based stones. So you're overloading the calcium content on the inside of the stone, on the inside of the kidneys, which then the calciums want to latch onto something, which then crystallizes.
So the sodium comes from salt. So that's a high salt,
Correct.
potentially a high salt diet. Where does the calcium come from?
So calcium comes from foods as well, but in addition, the calcium can actually be pulled out of our bones, right? So your body has a certain amount of calcium with it in the blood at all times, right? Your body has all these little molecules and substances within the blood that are normal. One of those is calcium, but it's being depleted, it's being pulled out of the blood because your body's trying to get rid of the sodium. So then your body has to respond and say, okay, well, now my calcium inside my body is low. Where can I get it from? It starts increasing the absorption from the intestines. It starts pulling it from the bones because it's losing it out the urine because it's trying to get rid of the sodium, the salt. Another big one is dehydration, right? You need to.
I was just about to ask you. I heard that sometimes people say to me, "Hey, you better drink enough water, otherwise you're going to get kidney stones." So is that
Mhm.
is that a real thing? Like, should we be drinking a lot of water?
Certainly. So it's definitely not a misnomer. And just think about it. I explained these little molecules want to come together and crystallize. Let's just say that these little molecules are the size of tennis balls. So say you've got 5 calcium tennis balls and 5 oxalate tennis balls. And one type of a kidney stone, most common, is calcium oxalate. So if these 2 tennis balls touch each other, now they formed a stone, right? So if you've got these 5 calcium tennis balls and these 5 oxalate tennis balls floating around in a trash can, in my office trash can, they're probably going to touch. But if you can dilute it and spread it out to, say, the size of this room, they might never touch. They're floating around, but they might never touch each other. So you're trying to dilute out the chemicals so they don't touch each other. And so dilution is one of the best ways to prevent kidney stones, aside from anything else dietary, is just trying to keep yourself well hydrated. The other example for keeping yourself well hydrated is that your kidneys are going to be constantly flushing. Okay. I was going to say, we've all left on a vacation for a couple weeks. You come back and you look at your toilet and it's got that rim of calcium in there, right? Why? Because the toilet's not being flushed constantly and the water's sitting there. So water that sits, it's going to want to start calcifying. So we need to keep flushing. So we need to constantly be drinking water, keeping that water moving.
So I have another question. I mean, I also understand that, like, for example, sugar is really bad. Just in general, it's bad for your health. Does sugar at all contribute to an increase in the probability of kidney stones?
Not really. So control of diabetes, which is sugar related, and I think that's a very difficult topic, is because everybody associates sugar with diabetes, but really it's breaking down different foods into the simple sugars, such as, apples and pears, and you're like, that's not sugar. Well, it breaks down into sugar, or breads, tortillas, chips, it all breaks down into sugar. So control of diabetes will certainly help you prevent or reduce your risk of kidney stones, but sugar in itself, no.
So sugar not directly, but indirectly, if it increases your chance of diabetes, with diabetes, there's an increased chance of kidney stone.
Yes.
Is that correct? So it's not a direct cause, but as a result of the diabetes. And then how about the other kind of bad guy in nutrition, which is like gluten? Does gluten in the form of like carbs and like breads and pastas, does that also contribute, or is it also, it turns into sugar and it increases the chance of diabetes, which increases the chances of kidney stones?
Yeah, so not so much. There are things that we try to avoid and reduce, but a lot of the targeting specific patients, you need to really figure out that specific patient. There's some general recommendations that I certainly make that I think help most stone formers. But if you really want the answers, you want to get urine testing, which what that urine testing is 24-hour collection of your urine in a container, which is a weird, but do it once or twice and it's not a terrible thing. And get some blood work, some basic blood work. And I think you can target a specific patient and their risk, right? So the way I explain it to patients is, there's more than 10 types of kidney stones, and there's multiple ways of making each type of kidney stone. When we used to do, let's go back years ago, we used to look at what the stone was. Everybody was so caught up about, I need to know what type of stone I have. And then we're going to prevent this stone. Well, that's only one piece of the puzzle. And in fact, nowadays, I don't even get that bent out of shape if I don't have a specimen of a stone or to know what type of stone they are, because really I'm targeting their risks. And so I advocate for patients that have had kidney stones and don't want them ever again, or patients that have recurring kidney stones, to really get the testing to figure out why they are making the kidney stones that they are making, and then how to target those risks. One of my pet peeves is actually that a lot of doctors don't push that testing, or they don't really know how to interpret that testing. So they get all the results back and they're not really sure what to do with it. Because it is a special understanding. I'm very specific in my treatment of stones and my management of stones, but not everybody dives in like that. And so I think there's a lack of the testing being done. And then if the testing is done, appropriate recommendations based on the testing. I'll give you an example that I see all the time. Patient will say, have a calcium oxalate stone. Well, the doctor tells the patient, you need to avoid calcium and you need to avoid oxalates. Well, oxalates is something that our viewers are going to have to Google that one, because it's basically, there's lots of different foods that have an oxalate content. And the oxalate is one thing that, when broken down, wants to connect binding with a calcium to make a stone. The unfortunate thing is oxalates are in a lot of healthy foods. So I tend to see a lot, like nowadays, I tend to see a lot of healthier folks getting kidney stones because they're on these health kick diets. Okay, and I'll give you some examples. High protein diets. High protein diets lower your pH, which I already explained before, put you at risk of making stones. And they also have a high uric acid content because you're breaking down the amino acids, you're making uric acid. Well, uric acid is one of those things that if you change the pH, it's going to crystallize. Just like water, you change the temperature, it's going to solidify. And so I see folks that are on these high protein diets end up with uric acid stones. And I see other folks that are on these, very healthy, fitness diets. They wake up and they have a kale smoothie for breakfast. Then they have a big spinach salad with some salmon, and they have the nuts on the salad, and they have the fruits on the salad, and then they're snacking on trail mix. Well, that patient just gave themselves an oxalate overload, because there's a high oxalate content in nuts, and they're chewing on trail mix all day. There's a high oxalate content in spinach. There's a high oxalate content in your green leafy vegetables like spinach, kale, your salad ingredients. And so I see these folks that are overloading themselves without knowing on things that are going to put them at risk of kidney stones, but they're doing it, to be healthy and fit and have less fat. So with diet, I always push for moderation.
More of a balanced diet.
Absolutely. You don't want to be all one thing, because you're going to put yourself at risk for something.
Okay, let me ask you this. I think the obvious way to know that you have kidney stones is excruciating pain. But are there any other ways to know that you have, are there any other symptoms where you would know that you have a kidney stone and you should go get it treated?
Yeah, so you hit the nail on the head. It's mostly the pain, right? But if you're asking, do you have a kidney stone? Well, as I alluded to before, you can have a kidney stone within the kidney that has not yet blocked the kidney. They can sit there for months, can sit there for years. The only way to really diagnose that is to get some type of an imaging study. An ultrasound is, I tell folks, about 80% accurate at identifying a kidney stone or something that might be a kidney stone. And those are pretty quick, easy. Most people are getting ultrasounds if, at some point, if they're seeing their physician routinely. A CT scan is the gold standard. That's what's really going to tell you if you have any calcifications or stones within the kidney. It's about 99% accurate, 98, 99% accurate. So it's very accurate. And so if the only way to really tell is with imaging. For the person at home that obviously doesn't have an imaging study, what you're going to look for is pain in your back. Pain can radiate to your front on the one side. Pain can radiate down into your groin or your genital region. You can have uh, bladder symptoms, almost like you're having a urinary tract infection. You can have urgency. You can have frequency, um, painful urination, things like that. You can have blood in the urine. If you have pain and blood in the urine, that's almost a telltale sign that you might be passing a stone. Then what we would check if you end up in an emergency room, which is most common, or in a physician's office, we would check the urine. We're looking for red blood cells and white blood cells because as that stone travels down that tube, it's going to scratch up the edges and you're going to get some blood which will contain red blood cells and white blood cells. Sometimes you can see the blood, sometimes you can't, but we'll detect it on a urine test. And then we'll usually want to get some type of an imaging study, which is an ultrasound or a CT, preferably a CT scan.
Okay. Who would you say, just moving on to the next question, who would you say is the most risk of getting kidney stones? I mean, for me, when I talk to people, I don't hear a lot of young people getting it. I hear more older people. And for some reason, maybe it's just me, but I hear it's mostly from men. I hear men mostly complaining about getting kidney stones. So is there a demographic of people that are more likely to get kidney stones? Like who's getting these stones as the
Yeah, so
majority?
you're absolutely right. So with age, there's an 8 to 10% risk in your lifetime you will get a stone. So think about, 1 in 10, 1 in 20 people will get a kidney stone. As you progress in age, you're moving along your lifespan, you're going to gain risk because that lifetime risk, well, now you get more and more years into it, you'll have a higher risk. Most of the time,
Sorry, it's
children,
not a direct. Sorry, it's not a direct relation to your age. You're just saying it's a probability as more time goes by. So it's not an age thing. So it's not something that we. It's not something that because you're older, your risk is higher. Your risk is higher because you've been alive longer. It's a
correct.
right. Okay, I understand. Okay.
Correct. And then there's things that I think we don't really prove it in our studies, but kids tend to play, be outside, drink a lot of water. We tend to be running around at work, trying not to drink because we don't want to run to the bathroom. And so, and then as you get older, retired age and beyond, your body sometimes doesn't handle all the water. So you'll get swelling in your legs, and so people avoid water. You have bladder symptoms for other reasons people avoid water. So I think there is a hydration component with age where younger folks tend to drink a lot more water than we do in working age, and then even beyond that in retirement, elderly age, people tend to drink less water. Uh, when you say that adults tend to get stones more than children, you're absolutely right. Many times when there's children with 1 or 2 stones, you're immediately looking for some type of a enzyme deficiency or some type of an abnormality that's not just a normal risk of creating a stone, but something else there. Like I said, in a lifetime, you have about an 8 to 10% risk. It is more common in men. You have a 10 to 11% risk in men, and women are about 6 to 7% risk, which has been going up over the last few decades. It used to be that men were about twice as likely to get a kidney stone as women, and now the women are very rapidly catching up to that over the last 30 years. The
Is it a
overall risk has gone
physiological?
up.
The
What's that?
overall risk for everyone has gone up.
The overall risk for everyone has gone up. I would say about 30, 40 years ago, I think it was about 6 to 6.5% risk, and now we're up in the 7 to 10% risk. for everyone.
In terms of the variance in risk between males and females, is it a physiological thing between men and women, or is it more of a lifestyle
Yeah,
reason between men and women?
we don't know. We've hypothesized all of the above. We've hypothesized that historically women would be at home while men would work. And most of our studies come from the US. And so we think about, okay, historic, there were some gender role differences, right? If you're at home, you're probably going to drink more water. You're taking care of the kids. The kids are drinking, you're drinking. Maybe it's just a hydration thing. Maybe you're eating better because you're at home, as opposed to, say, the husband or man might be working, avoiding drinking and eating on the go, right? So it maybe is that
Things have changed though in society.
we've hypothesized that. We don't really know. But the risk for women is definitely climbing more rapidly than the risk of men. Overall risk is growing for everybody, but the risk, women are catching up rapidly. It's about a disparity of about 7 to 10% between women and men now, and it used to be about half, 3 and 6%.
Okay. So next question. How are kidney stones treated? So someone has gone through excruciating pain, or they've had blood in their urine. They've come to you. You've analyzed their urine. You've done your CT scans, and now you've determined that this person has a kidney stone. So how do you treat that? Now, before you answer that, I hear obviously horror stories of people passing these stones, of people basically, I don't know, like taking days and suffering tremendously. How are you treating these stones once you've determined that they're there?
Great question. So, one thing to say, and I've alluded to this before, is it's always interesting because people will not want anything done. It's not bothering me. I don't want anything done. And the moment it starts bothering them, they want everything done. So I always recommend that if you think that you would rather treat this stone on your time instead of the stone's time, be proactive. If you know you have a stone, go ahead and get it figured out, treated, while you can arrange your work, your school, your lifestyle, take some time off and focus on treating the stone. As opposed to, I'm boarding a plane to Paris and now I have a stone and I want it treated yesterday because I'm missing my flight, right?
But Joel, what is that treatment? Like what does that treatment consist of?
Yeah, so there's four basically ways to manage any stone. Uh, as I go through the four options, I go from least invasive to most invasive, but in the same sense, least effective to most effective. Okay. And as well, stone size and stone location, stone density, how hard the stone is, those all play factors. Okay. But generally speaking, going from least invasive to most invasive, least effective to most effective. Number one, you can do nothing. You can watch it. You can watch it. If it's a small stone in the tube that's, causing symptoms, instead of just sitting back and watching it, a lot of times we'll do what we call medical expulsion therapy. And that's basically where we tell the patient, drink lots of water, uh, give them a medication that we believe helps increase the diameter of that drain tube just a smidgen, that might allow the stone to pass through it. That's called tamsulosin, or some type of an alpha blocker medication. Sometimes we'll do a non-steroidal anti-inflammatory like ibuprofen. Sometimes we'll add a steroid medication. Um, some people use diuretics, which help push more urine down. It basically activates the kidney into overdrive. So you're filtering more blood, making more urine, pushing more urine, giving more back pressure to the stone. So those are all different options for medical expulsion therapy, little things we can do or prescribe to try to help the passage time of the stone. But those are not surgical options. Then the other three options are surgical options. One is shockwave lithotripsy, and that's where we put you to sleep. And from the outside, you lay on this device that has a coupler that comes up to your skin and sends a sound wave of energy targeted by ultrasound and or x-ray to be aimed at the stone's position, and you hit that with a sound wave of energy over and over about 2,000 or 2,500 times in repetition. It takes anywhere from 15 to 30 minutes, and then we see if the stone passes or if the stone breaks up. We're not pulling the stone out. We're not retrieving the stone. We're not doing any scope. We're not doing any incision. We're basically just trying to crush the stone into little pieces that should be passable. The next surgical option would be ureteroscopy. Ureteroscopy requires no incision, but it does require going inside the body. So you go through the urethra. Again, patient's asleep. You go through the urethra.
I
So,
hope so. I hope so. It doesn't sound very nice. I would definitely want to be asleep for that.
especially for men, right? So you go through the urethra with a scope. You go
I
into the
think I know. I
bladder.
think I know. I think I know what a urethra is, and yeah, I wouldn't. I wouldn't. I wouldn't. Yeah. Okay. Please continue.
Basically, the flow of urine, we go backwards through the urethra into the bladder. Identify the two drain tubes going up to each kidney. Obviously, you know which side you're working on. Go into that tube with your scope and go up that tube until you identify the location of the stone, whether it be in the tube or whether it be in the kidney itself. And then you can use different instruments like a laser fiber to digitally, you're looking at the image on a screen. So you're looking at a monitor, watching your scope in action. You find the stone. I'm able to see the stone. I'm able to put a laser fiber on the stone. I'm able to activate the laser and actually break the stone, visualizing the stone, as opposed to shockwave lithotripsy, where we're looking at it on an ultrasound or an X-ray. I can't tell you, hey, I looked at the stone, I busted the stone, and I flushed out the stone. Or there's little devices that are graspers. You can grasp little pieces of the stone and pull them out. Obviously, with that, you're limited because it's 2020, whatever, and we've got scopes that literally do this, right? So it's the inside of the kidney branches like a tree, right? You've got the trunk and then bigger branches and smaller branches and all these little branches. So you're using a scope that does this to kind of navigate all these little areas of the kidney. And a lot of it is surgical technique by your surgeon twisting and turning the scope to get to the right position to find and be able to treat the stone. And then we have little devices like baskets and graspers that can pull out little pieces. But again, you're limited by the size of the ureter, which is that drain tube. So if you think about plumbing, plumbing is kind of backwards in our body. We have typical plumbing. You have small pipes. Think about your bathroom sink or your toilet that drain to larger pipes under your house, that drain to bigger pipes that go out to the street, that drain to the sewer. And then each pipe is getting bigger and bigger in diameter. Our body's kidney drainage system is kind of backwards. We have bigger pipes that drain to smaller pipes that drain to this little tiny tube that goes all the way down to the bladder. And it's a very small, delicate tube. And so we're limited with putting a scope in and out of that tube by the diameter of that tube and how big of pieces we can pull through that tube. So that's a significantly limiting factor for ureteroscopy. And then the final option is a percutaneous option called percutaneous nephrolithotomy, and there's different versions of that based on the size of the incision. And you make a small incision, anywhere from half a centimeter to 2 centimeters, and you make an incision and then pass the scope from above into the kidney, and you're able to pull out larger pieces or do things from above that you can't necessarily do from below. But that obviously requires an incision. You're going through the kidney, more bleeding, more of a surgical procedure.
And that's a general anesthetic as well. You're under for
General
that.
anesthetic. And it's
Okay.
typically reserved for larger stones.
Right. Okay. So now let's get to the 5 ways to prevent getting kidney stones. What is Joel? What is your advice? What is your medical advice? Because this whole thing sounds really nasty. Like this is probably, if you were to ask me, like, what don't you want to have happen to you? This would be probably number one on my list. Right after, like, making sure my family is safe and everyone's taken care of. This is probably like right after that. I wouldn't want to get these. So what are the ways to prevent? Well, what are the ways to
How can
prevent
we
this from
prevent?
happening? Yes.
So again, my biggest recommendation is if you truly want prevention, go for the workup, get the 24-hour urine. That's coming. Yes, that exactly is coming. I like to see you drinking that, by the way. How
I
much do
know.
you drink a day?
I probably go through like 5 or 10 of these a day.
5 or 10 of those. And that's what, about a liter?
That's about a liter. Yeah, I'm drinking a lot. Is
Oh,
that
you're
too
never
much?
going to get a kidney stone, Gary.
Woo!
No, you're doing great. If you're drinking like 3, 4, 5 liters a day, that's impressive.
Like these are always with me, always, everywhere I go. Yeah.
All right, so be like Gary and not like me, okay?
Okay, fair. Okay. So, but you were saying, okay, so number one is,
So certainly, I recommend for any patient that really wants to know, get the 24-hour urine collection, get some blood work done, speak with a nephrologist or a urologist who is comfortable with those tests and
hey guys,
understand
welcome
why
to Best
you are
Year.
at risk and
This
what
is
we
the
can do about
first
your
in
risk.
a new
Okay.
series of
Now, there's a
live
subset of patients that
interviews.
say, I'm not going to do all that. Just help me, right? What
No,
can
you're
I do?
doing great. If
And
you're
so,
drinking,
my top
like
recommendations would be
three,
number
four,
one,
five
we talked
liters a
about
day,
sodium,
that's
salt.
impressive. Like these citrates,
Processed
however,
foods,
orange juice has a lot of
deli meats,
sugars
restaurant
and a lot of
food, we
vitamin
all
C.
love
So you
eating
want to be
out,
careful how much
saturated
orange
in.
juice you're drinking. It sounds
And
to me like
so
in your
I
water,
very
like
commonly
again,
see
moderation with your diet. If you're
people
eating
tell me, oh, I
dehydrated,
don't salt
proud of
any of
you
my
and
food.
honored to
But
be
I
your
do
friend.
their urine
I'm so proud
studies
of alcohol. Is
and I see that they're
alcohol's sugar
sky
though, right?
high in their
And so
sodium levels.
in turn it
And so the
dehydrates,
recommendation is to
right?
have your salt
But it doesn't actually
less than
dehydrate the
2,300
kidney, it
milligrams a
dehydrates
day,
your body.
which that's a difficult
So
thing to assess because
there's
nobody's
actually
looking
been
at
no
what's the
studies that
salt
show
content of
increased
my
risk with
food that I'm
alcohol
eating, whether it be at the
when
dinner
you're
table at home or at a
phenomenal and
restaurant.
motivated.
But
A
just
lot of
know
people,
that
I love to
you
watch
need
and
to
see what you
be
guys are doing. It's been phenomenal.
very conscientious about
Joel,
how much salt
thank
you're
you. I
intaking.
really
And it's
appreciate this.
not how
This has
much salt
been
you're putting on
very
foods, it's
informative,
usually how
and
much salt is already
honestly, like
there
for
in the
me,
foods.
who is coming into this
Second
essentially
thing,
as a
so
patient,
citrate
and
is
somebody
a
who wants to
very
prevent
important
this
thing for
as
kidney
I grow
stones because it's
older.
the defender
I'm going to be
against
50 soon,
most kidney
and
stones.
definitely
Citrate
this
does
is
two
something that
things.
in your
Citrate
overall kind
is
of
the
care
one
for your
thing that
health
calcium
as you go
binds
through life.
to
This is definitely something
and stays a
that's really
liquid.
important. And
So
again, the
you're just going to
takeaways
pee it
are
out. So we want
water
calcium
with lemon.
citrate in your kidneys,
Get
not
checked.
calcium oxalate,
Do the type
not
of analysis
calcium
that you're talking
phosphate,
about.
not any of that
No
other stuff. We
salt.
want
So
calcium to
these are
bind
the.
with
Thank you
citrate.
very much. Have a great
So
day.
again, back to my,
Thank you so much for having
I'm
me.
sorry.
How do I get? Is that a
And for
supplement? Is it
more
in food?
information, so
To
it's
see how you can get
so
in
it's
touch
citric
with
acid,
Dr. Abbott,
right?
you
So
can
when you think
check
about
the link
citric
in the
acid, you think
description
about
box
lemons and
for.
limes, right? And so uh, that's why you hear people say all the time, lemon juice or lemonade works, and it does. It increases your citrate level, and you don't want to just take, you know, lemonade that's really sugar water. You want some real lemon or real citrate. And so if you find those things that say made with real lemon, you're going to get some citrate there.
Why
In your
wouldn't you just?
regular diet,
Why wouldn't you just squeeze lemon into your water?
you absolutely can, and that's actually preferred. So what we try to do is get at least 1/2 cup of lemon juice into your water daily. And so if you're drinking, you're hydrating like you're supposed to be, and you're squeezing in or pouring in at least a 1/2 cup a day of lemon juice, you're going to increase your citrate level, and then that's going to help defend against calcium's binding with other things that are going to form stones. So we want to keep your citrate level high, which is citric acid, which in your diet is fruits and vegetables. If you can mix lemon juice into your water, that's preferred. Orange juice is a great source of citrate. However, orange juice has a lot of sugars and a lot of vitamin C. So you want to be careful how much orange juice you're drinking.
It sounds to me like in your water, you squeeze lemons in your water. I mean, that's the kind of short. That's the short of it, because all
That's
this
the
other
short
stuff,
answer.
like orange juice and
Also,
lemonade,
for
it's so processed. It's sugar. It's like nasty stuff. No.
it is, yeah,
Yeah.
yeah.
Okay. Anything?
A
So
lot
is
of
there
the stuff
anything?
you buy, yeah.
So is there any? Are those the main things? Like, was there anything else? Were there any other ones?
Well, so real quick to just add on to citrate, a lot of soda pop drinkers out there. Okay, if you're going to drink soda pops, that's fine, but try to drink the soda pops that are clear or citrus or fruit flavored. Your Squirt, your Sprite, those soda pops are actually carbonated with citric acid as opposed to phosphoric acid. Phosphoric acid is your Coke, your Pepsi, your darker soda pops. So if you're going to drink soda pops, which we know has a lot of sugar and a lot of other problems, drink the lighter ones. It's going to give you a little source of citrate. I would say recommendation number 3 would be back to what you said, which is drink, drink, drink. You want to get at least 2 to 2.5 liters a day, which you're killing. You're getting double that. So 2 to 2.5 liters per day. And if you have a job where you're sweating a lot, if you're losing it in perspiration, whether you're working outside or in the gym, you obviously want to drink more than that. So that's more of a sedentary person. You want to drink 2 to 2.5 liters a day because you're going to be able to generate about 2 liters of urine a day. So if you're losing it other places, like you work out, you look good, you got to drink a lot more.
Thanks, buddy.
Um, and then and then moderation with diet. I think I spoke on it earlier. There's these fads with the diets of the high, and trust me, I want to be in shape, I want to look good, I want to do all that stuff too, but you want to be conscientious of the risks when you go on a protein diet, and you're going to increase your uric acid and lower your pH levels and put you at risk of kidney stones. When you're having your kale smoothies, spinach salads, and trail mix, and you're being healthy, but you're overloading yourself with oxalates. Again, moderation with your diet. If you're eating out every night, you're probably getting a lot of sodium, a lot of salt. If you're eating a lot of processed foods, grab and go foods, it's a lot of processed stuff, a lot of salt. So really just be balanced with your diet, not don't eat out, just don't eat out every single meal. Don't, you know,
It's like anything else when you talk about prevention. It really is about balance. And I've heard other doctors say
balance.
before, like, don't do anything extreme. Like you can't cut out certain food groups completely from your diet because yes, you might lose fat from your body in the short term, but to your point, specifically about kidney stones and who knows what else, cutting out certain food groups, like completely removing carbs. People do that because they're trying to lose fat. You don't know what other complexities occur, what other problems occur. I have a question that I think a lot of people are going to want to know the answer to. So there's certain vices that a lot of people have, and they're going to want to know if these vices contribute to kidney stones. So for example, like alcohol. Is alcohol's sugar though, right? Alcohol turns into sugar. So, but does alcohol have any kind of negative effect when it comes to kidney stones?
So I get the questions I get a lot, and you just hit it, was what about alcohol? What about coffee? So we used to tell people to avoid alcohol and coffee, and that was one of our general recommendations for reducing the risk of kidney stones, because in theory, it's a diuretic, right? Diuretic makes you pee more, and so in turn it dehydrates you, right? But it doesn't actually dehydrate the kidney, it dehydrates your body. So there's actually been no studies that show an increased risk with alcohol and coffee or caffeine. That's a misnomer that we've made recommendations on that aren't actually accurate.
Right.
So drink what you want.
Okay. Gotcha.
Just
Gotcha.
drink.
Dr. Abbott, thank you. And I think now that we're coming to the conclusion of this video, I don't think it's a secret. I think people understand that you and I know each other outside of this video. And just to give, if you're still watching, guys, just know that Joel and I, we've known each other probably going on. I don't want to age myself here. Probably about 24 years. 24 years.
Yeah.
And when I met you, you were not a doctor. And you blossomed into this doctor, in front of my eyes, and I'm obviously extremely proud of you and honored to be your friend.
I'm so proud of what you're doing, what Valeria's doing. You guys are phenomenal and motivating a lot of people. I love to watch and see what you guys are doing. It's been
Thank
phenomenal.
you, Joel. Thank you. I really appreciate this. This has been very informative. I honestly, like, for me, who is coming into this essentially as a patient. And somebody who wants to prevent this as I grow older. I'm going to be 50 soon, and definitely this is something that in your overall kind of care for your health as you go through life, this is definitely something that's really important. And again, the takeaways are water with lemon. Get checked. Do the type of analysis that you're talking about. Low salt. So these are the real cornerstones of prevention. And I think in general this contributes to a healthy lifestyle overall. And
Absolutely.
that's it. Thanks again, and I want to thank all the viewers for sticking around this long. Really appreciate it. And please, if you have any questions for Dr. Abbott, I'm fairly certain that Dr. Abbott will be monitoring the comment section of this video. And if you have any questions, please feel free to ask your questions, and we will do our best, from the Bestie team to answer your questions in the comments. And again, don't forget to like and share this video, and subscribe to our channel. Thanks to everyone, and Dr. Abbot, Joel, thank you very much. Have a great day.
Thank you so much for having me.
And for more information and to see how you can get in touch with Dr. Abbot, you can check the link in the description box for Pacific West Urology, and you can find Dr. Abbot there and get in touch with him. Hey guys, welcome to Bestie. This is the first in a new series of live interviews with doctors, with specialists in their field, to bring you the best and most up-to-date medical information about your health. So thank you for joining us today. For those who have been with us for some time, as I said, this is a new format. You know our older formats with the animation